We're going to get started with our last session now. That is a tough session to follow, but if there is any session to speak to the power of the U.S. Cleft community and the strength, it was definitely that one. My name is Krysta. I'm the manager of community development here at Smile Train. We know it's been a long day, but we just have one more session, and then we're going to get to go to Pinstripes and have our dinner to close it out. I'm up here with my emcees today. As Caitlin mentioned at the beginning of the conference, we're really excited to hear your ideas on how we can build out the U.S. Cleft community. So I'm going to hand it over to them in just a minute, but we just wanted to do a quick review of our programs right now for anyone that's not as familiar with Smile Train. So who is part of the Cleft community? We know that the Cleft community is such a large community here in the U.S., but for the context of our programs and what we'll be talking about today, we want to focus on the cleft-affected adults and their families, and this is primarily parents that get involved with Smile Train. We're investing in this area because we know there is such a great need. While Smile Train is an international organization, over the years, we've had so many people reach out to us wanting to get involved with us here in the U.S., wanting to share their stories and seeking that community that you've seen here in many of the sessions today. So Cleft Con is one of the initiatives that we have to build out the Smile Train Cleft community. You can see our goals up here. Ultimately, the overarching theme of our goal is really to create these personal connections that we're striving to create, not only here today, but some of the programs that I'll be touching on in a minute. We want to provide educational resources about Cleft with a focus on psychosocial challenges as well as psychological challenges and programming focused on each stage of the Cleft journey. Like I said, ultimately, we get a lot of people that reach out to us that haven't ever spoken to someone with Cleft or that just had a baby that was born with Cleft and really don't know where to turn. So we want to create that community and that space where they can come to us and we can direct them to either families here that have said that they wanted to get connected with other people, or our staff that can provide them the resources and Cleft clinics in the U.S. and really make sure that we are a resource not only internationally but in the U.S. as well. So one of these initiatives is our Cleft Community Advisory Council. You've probably heard the letters CCAC thrown around a lot today and last night. But the Cleft Community Advisory Council is a group of members that are cleft affected, whether themselves or have children that were born with cleft. And our members help advance our organization's communication strategies. They do a lot of outreach, a lot of education in their own communities, and a lot of advocacy efforts as well. The CCAC has expanded quite a bit in the last 4 or 5 years or so. I think we started with about 8 people, and we're up to about 60 people right now. I know we've done this before, but if all the CCAC members in the room could just stand up really quick. Yeah. Thank you. And like we mentioned, this is the first time that we've had so many CCAC members in the room. So if you'd like to learn more about the CCAC, I'm sure any of the people in the room that are on it would love to talk to you about it. Applications will open in December. It is a one-year calendar term beginning in January. And this is news. We've had such exponential growth in the CCAC, which is so fantastic, that in the 2023 year, we've decided to actually split it up into 2 groups, one for cleft-affected individuals and one for the parents of cleft-affected individuals. This will allow us to really cater the experiences, the meetings, have slightly smaller groups so members can get to know each other a little bit better. And yeah, just really make sure that we're providing all of the resources and support we can to each group specifically. Cleft Awareness Month, this is another initiative that we did for July a few years ago. We're hoping to continue to do more initiatives like this in the future, and if we have any suggestions on how we can do these campaigns or do these programs to raise awareness in your communities, we'd love to hear them. You can see the middle is a screenshot that's actually still on our website right now. We had our CCAC members create videos by answering questions that were created by the CCAC. Our videographers combined these, and they made really great videos for both cleft-affected members and parents of cleft-affected members discussing their experiences. We also sent out these swag bags. I saw someone had one in the audience today, so it's great to see people are still using them. And yeah, we're just really excited to be able to create these resources both online and raise brand awareness and raise awareness of Smile Train in everyone's local community. Cleft Con, we won't spend too long on this, but Cleft Con was created as a way to really provide an opportunity for members of the U.S. Cleft community to connect. As it was mentioned earlier, 2020 was virtual, 2021 was also virtual, so that's why we're so excited to be here for our first in-person event today. That being said, the virtual did allow us an opportunity to really create those connections globally, to have numerous sessions going on concurrently so we could really cater to each person's need, what they're looking for. So we are going to be continuing the virtual Cleft Con, which will be held on November 12th, 2022. And hopefully we will be able to continue these in-person events as well in the future. Our college scholarship program, this is a new program that we have. This is our first year of doing it, and we're really excited to be able to offer two college scholarships, possibly more in the future. We're going to see how the program grows, but it's been really popular, and we were able to provide these two students here the opportunity to receive our scholarships. You can see the criteria is on the right. We received so many applications this year, more than we expected, so we're excited to have the program continue growing. And if you are interested in it, or you know someone who may be interested in it, we'll have the applications opening in January, and they close in about May or so next year. Lastly, ELSA. I know a lot of people in this room have been very dedicated to ELSA advocacy and very involved with Smile Train's efforts here, so thank you to everyone who already knows about this and who has been working so hard on this. I want to make sure I get this right. ELSA stands for the Ensuring Lasting Smiles Act. It's a bipartisan piece of legislation that would close statewide gaps in coverage and mandate that insurance plans cover all necessary services related to both diagnosing and treating birth differences, including clefts. Right now, as many of you in this room know, there are a lot of situations which the insurance company is determining the treatment that is medically necessary, not the medical provider. So ELSA passed in the House on April 4th. If the bill isn't passed by the Senate by the end of this calendar year, it will need to be reintroduced to the new Congress in 2023. And that resets everything, so all of the work will need to begin again. So it's super important that we get this passed this calendar year, and you can visit smiletrain.org/advocacy to reach out directly to your senators and ask them to support this bill. My colleague Adina in the back there, if you wouldn't mind giving a little wave. She's been leading this effort, and we have so many advocacy efforts towards ELSA, so if you're interested in learning more on how you can support it, feel free to connect with Adina.
And it was really painless, honestly. You guys made it really easy, and like all the resources. I'm not someone who's frequently communicating with my elected officials, and it was honestly painless and really productive, so.
Yeah, and you can see here, this is a shot of our virtual advocacy day on Capitol Hill, where people, CCAC members, anyone's welcome to get involved, met with the senators virtually. We asked a lot of people to take photos. We asked them to get permission from their senators before taking screenshots, so these are all permissible to share here today. But it's just such a really amazing effort, and you can see it really is just as simple as putting in your contact information. We have that pre-filled out message there, so you just put in your contact information and you just click it and it gets sent to your local senators. All right, so I'm going to hand it over to our emcees. I don't know if I mentioned this, but this is a totally new program for us. Adina, Troy, and I have just really shifted our efforts solely on the U.S. Cleft community last year. So we've only really been doing a year of this programming dedicated to the U.S. Cleft community, dedicated to the space, creating new initiatives, creating new efforts, finding ways to unite people, finding ways to support people. So that being said, we know that we have a lot of room to grow, and we're really looking forward to hearing everyone's thoughts in the room. This is one of the few times that we have so many people in this room that understand the needs of the Cleft community, understand ways that we can improve, ways that we can connect and grow it. So we really, really want to hear your thoughts. We know it's a long day, but we're almost done. So I'm going to hand it over to our MCs to lead this discussion, and feel free, please, to just share anything, any thoughts, any suggestions you have for us.
Thank you, Krysta. And thank you all of the speakers and everyone for being here today. It's been just magical to share the room with so many inspiring, strong people. We want to hear from you. So firstly, how can we together strengthen the Cleft community?
And that can be like us here with the children, with parents, with hospitals. I mean, like we've all been through different experiences in this room. So like, this is your opportunity to like any little idea or thought you have, please take the opportunity to share it.
Yes.
I think you're saying is, so continuity is here. So, because we've moved, so our daughter was actually repaired by Smile Train in China. So, first 2 surgeries in China, came to the U.S., surgeries in Charlotte, then we moved to Nashville, surgeries in Nashville, now we live in Charleston, surgeries in Charleston, nothing. There is no continuity in care. And so that has been extraordinarily frustrating as the parent of a cleft-affected child. So that would be what I would want to see.
So would you like Smile Train to help like communicate amongst hospitals
Yes,
and
absolutely.
surgeons
Yeah. And give resources. I mean, I was lucky enough to go on a journey of smiles with them to Medellin, and what they're doing there is so superior to any of the care I've gotten here for my child. And just the resources, everything. They had everything together. And I've had to search for every little thing for my child. And that's just not right.
Right.
We live, you know.
So, like, we're from Peoria, and so we have a pretty big hospital there. There's the Children's Hospital of Illinois. However, when 3 of our babies were born at that hospital, and I know Lindsay and I had to, like, educate the nurses on how to feed our children, and we actually had to advocate, like, I know Lindsay was talking about this last night, like, they wouldn't put in an order for a feeding specialist to come until the baby was actually born. However, when the baby was born, obviously he was hungry, and
Fascinating concept, really.
yeah, you know,
Shocking.
yeah.
Big surprise.
And so,
big surprise.
yeah, that's like a whole, yes, like I don't know if there's like a pamphlet that can be sent out from Smile Train to hospitals explaining different methods of feeding. I also know that it's hard for parents to come by. Dr. Brown's bottle is the big one that everyone uses now. However, you can't just buy the disc because it's a choking hazard, but yet you can buy little other things. Maybe just providing those to hospitals, because I know you have to get them from the feeding specialist, like you can't buy them now? Okay, when I was gonna say, when I had Grace and I couldn't
I couldn't
find
buy
them.
them when local was low. I couldn't buy them.
But just maybe providing those to, or just education, I guess, a pamphlet, education, what a cleft is, and the feeding aspect of the cleft.
Yes, Carolyn.
And I don't know how it is now, but I know when I was born, the children that did not live in Jacksonville, they lived in real rural Georgia and things. A lot of times they missed their care. They didn't get their care because the distance, the accommodations to spend the night. So I don't know what's going on with it now, but I hope we're reaching out to those deep rural counties where the children are being suffered for something they have no control over.
Yeah, so kind of some of the same issues that we see Smile Train working with in other countries with transportation and stuff. So maybe something we could explore here because it's also our issue.
Yeah.
I think a bigger issue that we're all probably aware of is that the healthcare system in this country is fractured in itself. So there's a really big issue that we unfortunately are not all going to be able to address. But I think for me, educating myself before, I just threw myself in educating in myself. However, I'm in healthcare, so that's what I do. I know where to look for those resources. It's the people that do not have a healthcare background, and I think it starts in the OB offices from the initial idea that there's or where that diagnosis is initially given. I think even maternal fetal providers. There's just so many areas where people are turning, as Lisa had said. She was trying to get information and was sent to her from maternal fetal to her pediatrician, Well, the pediatrician's like, well, you don't have a baby yet, so you're not our patient. Same idea with, when I was in the hospital with Brody. I'm like, hey guys, speech eval, put it in now. And I actually already had I was already texting the speech therapist. So she was literally on the other side waiting for the order to go through. It's a broken process, it's just broken. And so I think advocating is the biggest thing, and I think it's really going to be in our healthcare systems, in our hospitals, and not just the big ones. It's got to be the little ones, the rural areas.
Yes.
Because kids and parents are going to fall through the cracks, and it's difficult enough, but they need that support from the very get-go. So,
one clarifying thing there: do you see that as supporting healthcare practitioners in kind of connecting the dots, or kind of bringing the empowered mom, empowered father approach to where at least where the cracks might be in the system and to guide your child through those? Which one would be? My mother was a post-op nurse actually for a cleft palate surgeon, and so when I was born, she knew how to navigate everything. I don't know if that solves the problem, but which approach actually works better in your mind?
Probably both. Probably both.
Great question.
It's both.
Probably both if we could.
It's both.
Okay.
So one thing that I want to think about, and I know Smile Train is going to listen, is advocating to them for expansion of the Cleft team. Maybe it is having someone come in and talk about insurance, but also for those of us that go past 18. Your Cleft journey does not stop at 18. And so you have to think about this of, depending on where that child is at 18, I may either get off of parents' insurance, or thankfully they may go up to 26. That's great. But what if I don't have that? And I now turn 18, I get insurance. I'm going to try to go to the same doctors that I've been going because they know they've done everything, they've seen everything, but they can't see me anymore. And so now, again, especially if you're on where you are in your Cleft journey, you have not built up your own community of Cleft, and now I'm out on my own. And hearing them have that, and especially knowing that Smile Train backs that, they'll listen. And so just expanding the Cleft team to beyond the age of 18. Even if it went up to 26 like it does for insurance, that would be great. So that way they can kind of move into that as they move into adulthood too.
Oh yeah, look at these hands. Oh
I
yeah,
love
that's
this.
what we like to see. All the hands.
You'll love to see it.
Okay, I want
You'll
to
love to see it.
I want to piggyback on what Iva just said. I'm an older adult, and I still need care. So it's really important. Like, I had to find my own prosthodontist that work with me. And so it's the same thing, getting a team for adults, because we need our care for the rest of our lives till we're no longer here. So that's what I wanted to piggyback on that.
Saw a couple in the back. Oh.
And I'll piggyback off of a couple different things that were said, and it's medical records. I happened to be able to get mine a couple years ago, and it was because I took a doctor outside of my practice, and he got my medical records from when I was a kid, so when I called for them, they existed. Mm-hmm. But for a lot of people I know, my friend Christine, her doctor's not around for years. Nobody knows where those records are.
My records were destroyed. My mom told me yesterday. She said, I wish that I could provide you with more information. I called there years ago, and, Dr. Turk is no longer alive or practicing, and I asked for your records, and I was told they were destroyed.
I think after a certain amount of years, they don't have to keep them.
Yeah.
Yeah, it's
Yeah.
like 7 years.
And-
Yeah, it's
my
not
own
long.
records have filled in a lot of gaps, but also I still
was
have
wild.
care.
Sorry.
And that's terrible that they destroyed the records. So.
So one of the things that I feel most passionate about and that I would like to see brought to the forefront is the psychosocial, psychological, and emotional aspect of anyone with a cleft. I mean, I think that that's a very big gap and neglected, where we talk about the medical, we talk about, the parents taking care of the child, but what about what they go through emotionally with all the bullying and the psychological support and emotional support? So I think that's a very big area that needs to be addressed and maybe, educated, but figure out some way to provide resources and provide an outlet for those teens, children, adults that need that support.
I know I saw a bunch of hands in the back.
Way in the back.
Everybody,
Yeah,
everybody
Sally's
needs a
good.
mic.
Just,
We just need lots of mics.
oh,
Hi, I just want to say that I think it would be good to create a network of specialists for adults, medical professionals that adults can be referred to. For example, I live in Seattle and I found only one surgeon that can consult me at this point in time about my situation, and he's the only one in the whole state. And that's kind of scary. Yeah. I feel like I don't have a choice, really, you know. If he is, for some reason, is not as good enough, you know, or is not skilled enough, I don't have a choice. I don't have anybody else to go to. And I think, but I feel like at the same time, there might be more people I just don't know about, or, you know, anybody else in my situation don't know about. And creating such a network or a list of professionals that adults, cleft-affected adults can consult with would be a great thing to do.
Like some
An
sort
overall
of
resource.
registry
Yeah,
that is
exactly.
accessible
Yeah,
both
register,
by individuals from the community, but also from healthcare professionals, so they can
Exactly.
refer
Yeah,
folks
exactly.
to them. Yeah.
Pregnant lady with a mic.
I'm coming back for you.
that's
Right.
okay.
Yes.
Hi, good afternoon. Just a couple of things. I've been with Smile Train now for 3 years, and I brought my daughter here today because I wanted her to know that she has a whole community of people that she can reach out to, and it's okay that she's different. I wanted, and I think I said this before, I would love to see more children like her age, more people that she can relate to. I know she's here today, but she's a little bored, only because she says, Mom, there's a whole room full of adults. So, but I think it would be nice for her to have her own age group that she can relate to. I do personally feel, I could be wrong, but I do personally feel that some of her outgoingness and might be a facade on what she's really feeling. I really don't know what she's feeling because she, of course, is not always going to tell Mom what she's feeling. But I think she would need her own support group, somebody that she feels that she can go to. But I also feel as a mom, as I was telling Meg a little while ago, when Delilah was born, or even when I was 26 weeks and I found out about her, I didn't have a support group. So like the other young lady just said, I had to do my own research. And I turned to Pampers. Pampers actually has a Cleft group. And I went to Pampers and I registered her, and I found out what was the worst case scenario of what the possibility of how she was going to look, because I had no idea. And she was always a diva in UDO. She was always like this, always. So we didn't really have an idea of how big her cleft was, although it was 13 millimeters wide. And when she had her first surgery, it was brought down to 9 millimeters. So they did an awesome job at Mount Sinai in New York. But I think as a parent, I went through a lot myself, where I turned myself off. I did not want anybody to see my child. I didn't want anybody to come see me. Don't visit me. I didn't know how to deal with my own feelings. And, you know, where my sons had pictures every single year, I did not do professional pictures for my daughter. I have tons of pictures, but I don't have professional pictures because I went through my own postpartum. Oh my God, don't comment, don't look at her, don't say, oh my God, what's wrong? I didn't want anybody looking for her. So maybe a support group, like the other young lady said, for us parents, you know, going through this before, you know, what can we expect? What can we do? Like they said, the hospitals nowadays, even in New York, do not offer this support. You know, I didn't know she had to sit up to eat with a huge nipple. I didn't know, you know, when I gave birth, it was a C-section, and they took her away to, you know, to the neonatal. I didn't even see my child. So C-section and all, I'm racing up to go see her. I needed to see her. And again, there is no education out there. Unless you are someone like me who's always talking, There are no resources whatsoever, and that's even being in New York. So I could imagine all the other countries or all the other states. It's really horrible. And like I said, I didn't know about Smile Train until recently, and this is huge. You guys are awesome. I came here last night and I said, oh my God, oh my God, Krysta. And it's really awesome. We really are a really big family. And my idol, Ashley. I love Ashley. But I want her to know that she's not alone, and she's going to be all right. And, like I told Meg a little while ago, she might have another 2 or 3 surgeries for jaw reconstruction and whatnot. But as a mom, I would sit in the bathroom and cry, or in the car, and say, oh my God. And then, okay, Sally, be okay. Oh, Delilah, it's going to be okay. And, we as parents have to be so strong for our kids, and it's so many emotions that we go through, and I give it to all of you. You guys are beautiful, and you're so, oh my goodness, we're just a different breed. We are a whole different breed. We are so strong. So again, if we can see a support group for parents and a support group for teenagers, I think that I would love to see that.
So what I'm hearing you say is I think in the summer we can have like a summer camp for kids and then like a spa retreat for the parents.
Amen.
Choreo crowd like that one.
I know. It's my hype crew. Louder. Come on. We got to really bring it.
Stefan.
Hey, y'all. Steph again.
Yes, right. You can come to the spa, or wherever you want to go.
You can come.
The bar and spa. I don't
we were at
judge.
the Otto bar, so.
Right, bar, spa. I'm not judging. Whatever you prefer.
So as we talk about accessibility, my father was in foster care, and he didn't get care for his cleft lip and palate until he's about 12, 13 years old. So we can get access to displaced kids in foster care. That would be great.
Yes.
That's an awesome idea.
Sign me
Thank
up.
you.
So to piggyback off what Sally said about a camp for her daughter or for children her age, I know in Florida there is a summer camp put out by one of the children's hospitals, but that's for children with all craniofacial disorders, not just cleft. I think it would be really fabulous, and this might be like a big project, to have a variety of summer camps that are geographically located so that it is affordable, maybe one within each state for children within different age groups, but also a retreat for parents and for adults with clefts, again, geographically located within the state so that it's affordable. A weekend similar to this, but just with maybe speakers, which is very involved, but something that the cleft adults can get together and the cleft children can get together and just share and make the friendships and the bonds. And, because they live within the same state, they can even continue that beyond the weekend.
You can support the kids. Right.
Well, yeah, and they can, it could just spin off where you can even have like a big brother, big sister, or like a mentor child thing. Because the one thing that I loved was talking to Delilah and just seeing her, and then even talking to Lucy, who, is like older than me, and just seeing like the generations, no offense, Lucy, but just seeing the generations, because I remember growing up not seeing anybody that was older than me and wondering, what's it going to be like for me when I get older?
Right.
And I'm sure, Delilah feels the same way, and while she might say, well, we're all adults and there's no children here, I think she also gets some level of comfort. I would hope that she knows that she's going to be okay as she gets older. So,
Right.
yeah.
Thanks, Christine.
Okay. So before we all jump to having weekends and all that stuff, I do think that Smile Train has the ability to make a directory. To be honest, that is genuinely where we're lacking, is finding doctors who will listen and not turn you down. Finding therapists who aren't going to say, I have no clue how to deal with this, because I've had that happen. And as someone who fell through the cracks and didn't get her palate fixed until I was 25, I definitely think that a lot of rural areas are missing out on the information that's out there. Now, Smile Train has been around since I was a kid, and you guys helped me when I was a kid. Thank you. But I do think that the directory is probably, honestly, the best way to go and put money into. because I don't know how many times in the adult group I've literally begged everybody from everywhere, okay, this person needs help, and they're in this state, this city. I know you live there. Do you know anybody? I can't keep doing that. So I would love to just have like a Smile Train link and just be like, here you go. And it be legitimate and updated, and that's it. I don't want a weekend. I'm good, but the directory, yes.
I make this comment because I'm a little too addicted to Twitter, but they have the concept of a blue check mark for like a verified type thing. Are you referring to something like that?
Yeah, like a list.
Yeah.
Hello, I work for Smile Train, and going forward with more than just a weekend. My job is with programs, so what I do is that I work with partners and I ask them, what do you need to make your program possible? From surgery to speech therapy, nutrition, all of that. And I think my question really is for all of you, with all these ideas and all the things that we could do, like the camp or like the director, that thing. English. Like, definitely come up to us and tell us what we can do to facilitate that, like to help you with all those ideas. Because you are the community. You're the ones who are living it every single day. And our job is to make your life easier in a way so that you don't have to go through it alone. And then there's no other person that goes through it alone and doesn't want to share pictures of their child, and goes through that stigma. So definitely come up to us and tell us how we can help. And if you don't think about that today, you can always send an email. We're always on call, so just let us know.
There's so much I could say, but I'm trying to keep myself together here. This has been amazing, and I'm so inspired. And Troy is sick of me saying this, but I would really love to see intentional connections with our underserved populations in the United States, our immigrants, our Latinos, our different diverse backgrounds, our African American community, and to see how we can have intentional, we talk about advocacy, and at least in my case, I'm somebody with access. I have accessibility, and I can go and I can, I get frustrated because I have a high level of education. I have a doctorate degree, and I can't figure out so many things, right? And so it's very frustrating. And then I think about, well, what about, the Latina who's only been here 5 years and has to figure things out and may not understand the system or this or that, what are her options or his options? So partnering, and of course, in Espanol, I'm waiting to do one in Spanish as well. I think that would be a really neat opportunity to expand. And again, I understand that we're still in the beginning stages with the U.S. community, but really making it as inclusive as possible.
So I have had the pleasure of getting to speak to many of you, but not all. So I just wanted to take a moment to introduce myself. I'm also a Smile Train staff member. My name is Melissa, but I have been kind of intently taking notes, one, because Krysta asked me to, but also, also because it's really helping, kind of me inform my work. And so similar to Anna, I'm on the programs team. So I'm a little different. I'm not as focused on the Cleft community, but I work really closely with Adina in really trying to support the Cleft community, but rather through our Cleft team partners. So a lot of what you all are saying is really kind of resonating with me. And I will say that I've only been in this role for about 8-9 months or so it's new to the organization. And most people, other than you all, have a much better understanding of our work abroad. we've always kind of had this programmatic footprint, or I shouldn't say always, maybe for about a decade, we've had this programmatic footprint in the US, but it's been quite small. And then we kind of had this realization that, yes, there's this great need abroad, but there's a lot of need here too in the US, in our own backyard, and there's so many gaps to fill. So I am currently a one-person, one-woman show, and I have a huge, kind of charge ahead. But I just wanted to comment on some of the things that you guys have mentioned in terms of the needs and say, I'm happy to say that, we're kind of doing some of this already and really working with the Cleft team. So things like trying to, support some of the more underserved populations and helping to fund their travel, their transport, their hotel stays if that's needed, providing teams with Dr. Brown's bottles and things like that. So I just wanted to say hello and welcome you guys to also please come up and, talk to me throughout the evening if you do have more ideas. And I'm happy to share my contact information as well. So that's all. Thank you so much.
Any other comments?
I just wanted to say about the camps. I know Riley Hospital in Indianapolis, they sponsor a camp. It's called Camp About Face. I believe it's at Bradford Woods. I don't think they've had it since COVID started. It was supposed to happen this year, and I think they canceled it at the last minute. I know it starts with children 8. I think it's 8 to 14, and then older ones can also be counselors. And then I know there's one in like New Hampshire also because he did a virtual camp with them. So there are several places that have those camps, and I hope that he can go to Camp About Face one day. Hopefully they have it in person like next year.
So we have just about 3 minutes left. Anybody else who has any more questions, absolutely please share. But I just really quickly, before the clock runs out, want to thank Troy and Krysta and Adina and the rest of the Smile Train staff for putting this all together and bringing us all together to give us a platform to be able to speak and meet each other. So thank you.